Hello everyone, I'm Leslie Cornwell, certified nurse midwife with Empowering Midwifery Education. This section has to do with physiological childbirth. A legal disclaimer we put at the beginning of all of our presentations. This information is for general and educational use only. Content is not intended to substitute for professional, legal, or clinical advice. We strive to keep our information as accurate and timely as possible, but make no promises and guarantees it works for your local unique situation. The course objectives, the students will be able to verbalize what exactly is normal physiological childbirth. They'll be able to verbalize the benefits of physiological childbirth to the midwives, to the moms, to the babies, to society as a whole. They'll be able to verbalize the characteristics of what makes the definition of physiological birth. They'll be able to verbalize factors that influence that normal physiological childbirth happening versus the traditional medicalized birth scenario. This topic is really important because to go back to the basics to understand what are the two paradigms, the two variations of childbirth and how we care for people and how we take care of them have an impact on interventions and mindsets and fear and complications and culture. And so going back to the basics is always a good thing. To talk about to women what is normal and supporting normal during pregnancy and birth and having the skills to do labor support, education, advocacy, variations of normal versus these are emergencies, these are complications, this is when we intervene and support you, versus the traditional medical system. Disease process is the affiliation with childbirth. You're a ticking time bomb. We need to get the baby out as fast as possible. There's a lot of fear, a lot of anxiety. There's routine interventions done all the time because things are perceived they have to be done to women versus her body is comfortable and knows what to do and we're available just in case. So it's a very different training. It's a very different philosophy. It's a very different impact on the mom and the baby and community as a whole. So what is physiological childbirth? It's the power by the innate human capacity for the mother and the baby. It's a safe and healthy, without interventions, disrupting the normal birth process itself, dimming the lights, giving a safe, comfortable environment, letting her instinctually birth out her baby where we've got the resources and tools around. As soon as we start kicking in that fight or flight, as soon as we start creating an environment that's medicalized and sterile and has all this high-risk equipment, the fear and anxiety goes through the roof. The high epidural rates, the high interventions, the high inductions, the high C-sections. And so physiological childbirth is a very hallmark training characteristic of midwifery that we are promoting normal, healthy physiological changes and psychological changes happening in her body, that we're trusting this evolutionary process, but we've got the knowledge and skills to help if there's a deviation of normal. So the benefits of physiological childbirth, it has massive benefits to the moms and the babies and the midwives and the community as a whole. You're going to reduce the risk of infant and maternal morbidity and mortality. You're going to drastically decrease the C-section rate, the complications during labor, during postpartum, to the mothers, the babies. There's a ripple effect because if the mom now ends up in an unnecessary C-section and she can't have a good milk supply and she's got iron issues and anemia and she's tired and exhausted and she didn't immediately get to be skin to skin with her baby, she's going to have bonding issues, she's going to have mental health issues, she's going to have trouble with breastfeeding and higher formula, and then that causes infection risk and complications for the baby. Like, it's just a cascade effect of if we do not embrace and support physiological birth, it's not just the birth outcome, but it's a lifetime impact for the mom and baby and the community as a whole. We want to reduce the maternity care costs by unnecessary interventions. It's hard in the healthcare system. I am a capitalist at heart, but it's very frustrating to me to see the massive conflict of interest and the monopolies and the deep-seated not allowing free markets to occur in healthcare, where you're incentivized by the insurance companies to do more interventions. You get paid more for C-sections and epidurals and labs and interventions than what the hospital gets paid for normal, healthy moms and babies delivering. And so it's hard. It's very difficult when our system as a whole is set up for a financial incentive, an assembly line, and interventions and complications. Then the quality and the proactive incentives of giving good outcomes is what you're financially rewarded with. So physiological childbirth also affects the babies. We talked extensively. There's a lot of hormones the baby expresses during the birth process. The trauma, they're doing more and more studies of the impact of how the baby can remember their birth, even if it's on a deep subconscious level. Their experience, was it gentle? Was it traumatic? Was it bright lights? Was it a lot of aggressive people grabbing? Or was it being comforted by their mother as they come into this world? There's so much that we don't know of the complications and the potential outcome ripple effect with that person and their identity and their whole impact, not just the breastfeeding, the infection, the medical complications that can occur. It's also the bonding and the personal identity and the outcome of that baby for the rest of their lives. And so even the labor support team, there's so much benefits to physiological childbirth. It's a lost art to do intermittent fetal monitoring and to have low epidurals and see natural childbirth, true natural childbirth in the hospitals anymore. Like the retired nurses that did it before there was epidurals, before there was continuous fetal monitoring, before all these interventions, they're retiring and they're not passing on that knowledge. We're getting this ripple effect of residents and physicians and nurses and midwives, even in the hospital setting, that don't know how to take care of normal anymore. We're very blessed in the physiological childbirth aspect of community-based midwife, community-based birthing has the advantage with birth centers and home births of really being able to provide a safe, calming physiological birth environment with the right people and the right mindset in place. It's not what's on the walls. You can have physiological childbirth on a floor of an OR if you wanted to. It's not, I mean, you could have a medicalized, managed birth at home because of the influence of the care provider and their interventions and what their biases and influences being brought to the birth experience. So we have to be very careful of us, of labor support team, of our interventions and our culture and our stress and our past trauma and our influence on the birth process to families. So you want to talk about the benefits to you. I mean, there's so much with improved professional satisfaction, less burnout, quality measures, better service line, reduced complications. We want healthy mom and babies out there, and you want a long sustainable practice. You want to be in the hospital not worrying about lawsuits left and right. You want to love your job. You want to feel like you're giving midwifery on the terms that you want to give midwifery. And sometimes if you work for someone else, you're part of a bigger healthcare system, you may not be able to do physiological childbirth. I can tell you over and over again, my practice style completely changes when I do my locum assignments based on the norms of that culture and that facility. I'm there to fill in and I will add my little bit of style, but if it's too far out of the physiological childbirth realm, you're going to be accused and questioned that of safety, even though it's not the cultural norm in that area. And so there's always an art to adapting, especially as midwives, because we're squeezed between the nurses and the obstetricians and the doctors in the hospital system, versus if you're in the home, you're in a birth center, you're in your private practice, you really get to do the most autonomy possible for physiological childbirth. So these are some key characteristics: spontaneous labor, progression of labor on their body's terms, they're able to move freely, no routine IV, no routine continuous intervention, they're able to birth and instinctually move and flow and express things and make key decisions over their body on how they want to. They can put their guard down. They really are surrounded by people that they trust and they love and that they are supported by, versus they don't know this nurse. They've never been in this place. It makes them anxious. We are mammals. Our adrenaline kicks in. We can stop and start our labor however we want. So we don't give enough emphasis on the psychological component of childbirth and the physiological support. It's not just her body having a baby. If her mind is anxious and scared and she's not feeling safe, it's going to be a long, drawn-out process until we help and support that. So we can increase the chances of a vaginal delivery, of skin to skin, normal physiological birth, the baby being held by the mom and baby being held by the mother the entire time, and breastfeeding, and normal physiological blood loss just because of the oxytocin surge from the nursing, and that normal. If you're anxious just as much during labor, you're going to have unnecessary complications in the postpartum period, especially if the baby has some bleeding and some problems and the mom's nervous. her fight or flight and that adrenaline kicks in and her uterus isn't going to firm up. So it's really important as midwives and care providers that we handle emergencies, but we do them in a professional way. I've got this. I know what to do. I'm telling you what's going on. Just because there's something traumatic happening as far as like a bleed or a newborn resuscitation, you can show them in front of your patients, like, I've got this. Look at the baby is starting to breathe. We've done a mask. Baby just needed to get the lungs opened up a little bit. Look at your baby starting to look around. The heart rate's improving. Like having that good communication so that your mother and your family is very confident in those rare situations that you know what you're doing and you can support going back to normal physiological birth. So there's a lot of factors. We've already talked about a lot of them. Some things you can control with physiological birth factors and some things you can't. You can't control this woman's mindset and the trauma she had as a child and her partner having something terrible happen to him during the birth or during labor, and her last baby was a fetal demise, and that's all that's in her mind. But you can help her throughout the pregnancy with eating well, exercising, answering her questions, decreasing the anxiety as much as possible. You can do as much as you can to influence the best outcomes, but there are some things like she's going to do what she's going to do. She's going to have fear, she's going to have anxiety, she's going to take a childbirth class or she's not going to take a childbirth class. She's going to have a support team around her and a doula, or she's going to go unassisted at home. Like those are decisions you can't control with supporting the rights of what that woman directly wants. As far as the midwife, the healthcare provider, their knowledge, their skills, their training, their experience, maybe they're tired and exhausted at the end of their shift. Maybe they've been on vacation the last 2 weeks and they haven't seen normal birth in quite a few years. They've never done a water birth before. They haven't practiced for a while. They're a new graduate. They're well established. They're near retirement. There's so many variables that can affect their fear, their biases, and maybe it's policies and protocols within the hospital system and supplies, and maybe the mom wanted nitrous oxide, but now we can't use it because the equipment's not working. So there's a lot of influence with the physiological birth aspect of, does this person know the different skills and interventions to position and rotate a baby with cardinal movements of labor, or does she just tell her to get an epidural and then eventually they just check her 2-3 hours later and give her a C-section? So the influence of the care provider is massive. The birth setting, the environment, the people around them, the equipment. Is it set up for a home-like environment or is it set up as sterile and medicalized? Are the lights bright? Are there lots of noises from the fetal monitor beeping, or is it calm and there's aromatherapy and there's music and there's water and there's warmth and it's dark and it's peaceful? And there's huge variations of what we set up for the birthing experience and the space, just as much as there is for the mother and the family and the support team that's around her. So you want to be able to offer good nutrition versus you're restricting. You want to reduce that challenge with mobility and letting her instinctually listen to her body. So normal physiological birth is something that's just innate in human body. Our culture and our society is losing that. It's influence and putting our own biases, whether it's fear and our anxiety and what we believe is normal, because we just haven't seen normal in so long. I think we're very blessed for community-based midwives. We get to surround ourselves by normal physiological birth all the time, but the people that practice in the bigger hospital system, it's extremely rare, and I would say like even impossible to see normal physiological birth because of our routine interventions for that bigger assembly line. Whether you're high risk, low risk, this is what we do to everybody. So it's really interesting, and I've been so blessed over the years to practice in multiple states, practice in multiple settings. I love home births. Home birth, even the difference between home and birth center, you're getting in a car, you're driving to someone else's space. It's still foreign. It's still their territory as the healthcare provider of the practice. When you are at a home birth, you are the guest. They can shut the door on you. They have the most autonomy over their body and say, and that the way it should be. And so I really love to support to the nth degree physiological childbirth and what that can look like and the ripple effect it can have for our moms, our babies, our families, and the society as a whole.